Question 1. A patient with a suspected brain injury is admitted to the ICU. Which assessment is most critical to determine the patient's neurological status? A. Monitoring blood pressure trends. B. Glasgow Coma Scale (GCS) assessment. C. Assessing the patient's heart rate. D. Monitoring urinary output. Answer: B. Glasgow Coma Scale (GCS) assessment. Rationale: the Glasgow Coma Scale is a quick and reliable tool for assessing the level of consciousness in patients with head injuries. Blood pressure trends, heart rate, and urinary output are important, but secondary to assessing consciousness in a traumatic brain injury. Question 2. A patient with a severe brain hemorrhage develops pupil dilation on the affected side. What is the nurse's priority action? A. Prepare the patient for immediate surgery. B. Administer hypertonic saline to reduce intracranial pressure. C. Assess the patient's level of consciousness and notify the healthcare provider. D. Check the patient's blood pressure and reposition them. Answer: C. Assess the patient's level of consciousness and notify the healthcare provider. Rationale: pupillary changes in brain hemorrhage can indicate increased intracranial pressure (ICP). The priority is assessing consciousness and notifying the healthcare provider. Hypertonic saline may be used later, but initial assessment and communication are crucial. Immediate surgery may be needed, but is secondary to the assessment. Monitoring blood pressure and repositioning are necessary, but they don't address the emergent situation. Question 3. A patient presents with severe facial weakness, drooping of the eyelid, and loss of the sense of taste. Which cranial nerve is most likely affected? A. Cranial nerve I. B. Cranial nerve 7. C. Cranial nerve X. D. Cranial nerve 12. Answer: B. Cranial nerve 7. Rationale: cranial nerve 7 facial nerve controls facial expressions, eyelid movement, and taste sensation on the anterior 2/3 of the tongue. Loss of taste, eyelid drooping, and facial weakness are indicative of a facial nerve issue. Cranial nerve I olfactory is responsible for smell, cranial nerve X vagus for swallowing and speech, and cranial nerve 12 hypoglossal for tongue movement. Question 4. A patient diagnosed with a brain tumor is experiencing new onset of hemiparesis. What should the nurse assess first? A. The patient's level of consciousness. B. The size and location of the brain tumor. C. The patient's motor strength and function. D. The patient's speech and ability to communicate. Answer: C. The patient's motor strength and function. Rationale: hemiparesis indicates a weakness on one side of the body, and the priority is to assess motor strength and function to evaluate the impact of the brain tumor. The level of consciousness, tumor size, and communication abilities are also important, but secondary in this situation. Question 5. A patient presents with an acute onset of sudden, severe headache, vomiting, and altered mental status. What is the nurse's immediate concern? A. Possible stroke. B. Increased intracranial pressure, ICP. C. Migraine headache. D. Brain tumor. Answer: B. Increased intracranial pressure, ICP. Rationale: acute headache, vomiting, and altered mental status are signs of increased intracranial pressure, which requires immediate intervention to prevent brain herniation. While stroke, migraine, and brain tumors can cause similar symptoms, ICP is the most urgent concern in this scenario. Question 6. What is the priority action for the nurse when a patient with a history of seizures is admitted after a head injury and is experiencing post-traumatic amnesia? A. Administer the prescribed anticonvulsants. B. Protect the patient from injury and ensure a safe environment. C. Monitor the patient's vital signs frequently. D. Perform a full neurological assessment. Answer: B. Protect the patient from injury and ensure a safe environment. Rationale: the patient is at risk for further injury due to post-traumatic amnesia and a history of seizures. Protecting the patient from injury and providing a safe environment are the highest priorities. Administering anticonvulsants, monitoring vital signs, and performing a neurological assessment are also important, but secondary to ensuring safety. Question 7. A patient with a history of stroke is at risk for developing a deep vein thrombosis, DVT. Which intervention should the nurse prioritize? A. Administer anticoagulants. B. Encourage early ambulation. C. Apply compression stockings to the legs. D. Perform passive range of motion exercises. Answer: B. Encourage early ambulation. Rationale: early ambulation is the most effective way to prevent deep vein thrombosis, DVT, in stroke patients, as it promotes circulation. While anticoagulants, compression stockings, and passive range of motion exercises are important, encouraging ambulation should be the first step in preventing DVT. Question 8. A patient presents with sudden onset of right-sided weakness, confusion, and slurred speech. What is the nurse's first priority action? A. Administer aspirin. B. Call a code stroke and prepare for a CT scan. C. Place the patient in a side-lying position to prevent aspiration. D. Assess the patient's blood pressure and oxygen levels. Answer: B. Call a code stroke and prepare for a CT scan. Rationale: sudden onset of neurological deficits, weakness, confusion, slurred speech suggests a stroke. The nurse should activate the stroke protocol and prepare the patient for a CT scan to determine whether the stroke is ischemic or hemorrhagic. Administering aspirin, positioning the patient, and monitoring vital signs are important, but timely imaging is critical. Question 9. A patient with an ischemic stroke is receiving thrombolytic therapy. What is the most important nursing consideration during this therapy? A. Monitor for signs of hemorrhagic transformation. B. Assess for signs of deep vein thrombosis. C. Encourage the patient to drink fluids to stay hydrated. D. Restrict the patient's movement to prevent further injury. Answer: A. Monitor for signs of hemorrhagic transformation. Rationale: thrombolytic therapy carries a risk of hemorrhagic transformation, where the ischemic tissue may start bleeding. The nurse should closely monitor for signs of bleeding, e.g., changes in neurological status, hematoma formation. Other interventions, such as monitoring for DVT, hydration, and restricting movement, are important but secondary to monitoring for Question 10. A patient with Parkinson's disease is prescribed levodopa. Which instruction should the nurse include when educating the patient about this medication? A. Take your medication with food to prevent nausea. B. Avoid taking this medication with high-protein foods. C. You can stop taking this medication if you feel better. D. You may experience a sudden drop in blood pressure when standing. Answer: B. Avoid taking this medication with high-protein foods. Rationale: levodopa is absorbed in the small intestine, and high-protein foods can interfere with its absorption, reducing its effectiveness. Taking the medication with food is generally recommended for nausea, but it's important to avoid high-protein meals around the time of taking levodopa. Stopping medication is contraindicated, and a sudden drop in blood pressure is a common side effect of Parkinson's disease itself, but not directly related to levodopa. Question 11. A patient with Guillain-Barré syndrome is being monitored for respiratory failure. What should the nurse assess most frequently? A. Level of consciousness. B. Respiratory rate and oxygen saturation. C. Bowel and bladder function. D. Pain level and comfort. Answer: B. Respiratory rate and oxygen saturation. Rationale: Guillain-Barré syndrome can lead to progressive muscle weakness, including the respiratory muscles, which may result in respiratory failure. The nurse should assess respiratory status frequently. While other assessments, consciousness, bowel and bladder function, and pain, are important, respiratory monitoring is the priority in this condition. Question 12. A patient with a severe traumatic brain injury, TBI, is being monitored for increased intracranial pressure, ICP. Which position should the nurse avoid? A. Head of bed elevated at 30 degrees. B. Head of bed elevated at 45 degrees. C. Flat, supine position. D. Head of bed elevated at 90 degrees. Answer: D. Head of bed elevated at 90 degrees. Rationale: elevating the head of the bed at 90 degrees can increase ICP due to the increased pressure on the venous drainage of the brain. A head elevation of 30 to 45 degrees is ideal for reducing ICP. The flat position may also be avoided if it leads to impaired venous return. Question 13. A patient who suffered a stroke presents with dysphagia. What is the most important initial intervention? A. Assess the patient's ability to swallow. B. Offer thickened liquids to the patient. C. Place the patient on a puree diet. D. Consult the speech therapist for an evaluation. Answer. A. Assess the patient's ability to swallow. Rationale. Dysphagia is common after a stroke, and the first step is to assess the patient's swallowing ability to determine the risk of aspiration. After this, appropriate interventions, such as thickened liquids, puree diets, and speech therapy can be considered. Offering food or liquids without assessment can lead to aspiration. Question 14. A patient with a history of seizures is receiving phenytoin. What should the nurse teach the patient about this medication? A. It is important to take your medication at the same time every day. B. You may stop the medication if you no longer have seizures. C. You should avoid taking this medication with food. D. You can drink alcohol while on this medication in moderation. Answer. A. It is important to take your medication at the same time every day. Rationale. Phenytoin is an anticonvulsant that requires consistent dosing to maintain therapeutic levels. Stopping the medication without guidance can lead to a seizure recurrence. Taking the medication with food does not interfere with its absorption, and alcohol should be avoided due to the risk of interactions. Question 15. A patient who recently underwent a craniotomy for a brain tumor is at risk for cerebral edema. What is the nurse's priority action? A. Administer corticosteroids as prescribed. B. Position the patient with the head elevated at 30 degrees. C. Monitor for signs of infection at the surgical site. D. Encourage the patient to increase fluid intake. Answer. B. Position the patient with the head elevated at 30 degrees. Rationale. Elevating the head of the bed at 30 degrees promotes venous drainage and helps reduce cerebral edema after surgery. Administering corticosteroids may be part of the treatment plan, but positioning is the first intervention. Monitoring for infection is important, but not as urgent as managing cerebral edema. Fluid intake should be controlled to avoid increasing ICP. Question 16. A patient with a recent stroke is exhibiting signs of neglect of their left side. What should the nurse include in the care plan? A. Provide frequent reminders to the patient to use the left side. B. Ensure that the environment is free of obstacles on the left side. C. Encourage the patient to complete tasks using their left side only. D. Promote independence by allowing the patient to care for the left side. Answer. B. Ensure that the environment is free of obstacles on the left side. Rationale. Neglect of one side of the body, often seen with right-sided brain injuries, means the patient may not be aware of or use that side. Making sure the environment is free of obstacles helps the patient safely navigate and use the affected side. Reminders, encouragement, and promoting independence are important, but secondary to ensuring safety. Question 17. A patient with Alzheimer's disease is becoming increasingly agitated and combative during care. What is the nurse's first priority intervention? A. Administer the prescribed sedative. B. Redirect the patient to a calm environment. C. Ensure the patient's physical needs are met. D. Call for assistance from security staff. Answer. B. Redirect the patient to a calm environment. Rationale. Redirection to a calm environment helps manage agitation in patients with Alzheimer's disease. Sedatives should be used cautiously, and physical needs should be addressed, but creating a calm environment is the first step in managing behavioral symptoms. Calling security is inappropriate unless the patient is a danger to themselves or others. Question 18. A patient with a spinal cord injury is developing signs of autonomic dysreflexia. What should the nurse do first? A. Administer antihypertensive medications. B. Raise the head of the bed to a sitting position. C. Assess for and relieve the cause of the dysreflexia, such as a full bladder. D. Perform a full neurological assessment. Answer. C. Assess for and relieve the cause of the dysreflexia, such as a full bladder. Rationale. Autonomic dysreflexia is typically caused by bladder distension or bowel impaction, and addressing the underlying cause, such as emptying the bladder, is the priority. Raising the head of the bed may be helpful, but it is not the first intervention. Administering antihypertensive medications and performing a neurological assessment are important, but secondary to resolving the cause. Question 19. A patient is recovering from a stroke and is showing signs of emotional lability. What is the most appropriate nursing intervention? A. Reassure the patient that these feelings will pass. B. Use therapeutic communication to help the patient express feelings. C. Encourage the patient to suppress emotional outbursts. D. Administer an antidepressant as prescribed. Answer. B. Use therapeutic communication to help the patient express feelings. Rationale. Emotional lability is common after a stroke due to brain changes. Using therapeutic communication helps the patient express their emotions in a healthy way. Reassurance is important, but the nurse should provide support for emotional expression. Suppressing emotions can worsen the issue, and antidepressants are not the first-line treatment for this symptom. Question 20. A patient with a history of epilepsy is scheduled for an EEG. What is the nurse's role in preparing the patient for this test? A. Ensure the patient refrains from eating before the test. B. Explain the procedure and ensure the patient understands it. C. Administer an anticonvulsant medication before the test. D. Encourage the patient to take a nap before the test. Answer. B. Explain the procedure and ensure the patient understands it. Rationale. Explaining the procedure is essential for reducing anxiety and ensuring the patient is well prepared. The patient may be asked to refrain from eating for specific types of EEGs, but this is not a standard requirement. Anticonvulsant medication should not be administered before the test unless ordered. Encouraging a nap is inappropriate, as the test requires the patient to remain awake. Question 21. A patient with a traumatic brain injury, TBI, is being monitored for signs of cerebral edema. Which of the following signs is most indicative of increased intracranial pressure, ICP? A. Decreased blood pressure. B. Irregular breathing patterns. C. Bradycardia. D. Hyperreflexia. Answer. B. Irregular breathing patterns. Rationale. Irregular breathing patterns, such as Cheyne-Stokes respiration, are commonly seen with increased intracranial pressure, ICP. Decreased blood pressure, bradycardia, and hyperreflexia are not typically the first signs of elevated ICP. Question 22. A patient who had a stroke is experiencing dysphagia. The nurse should first assess for which of the following complications? A. Dehydration. B. Aspiration pneumonia. C. Electrolyte imbalances. D. Sleep disturbances. Answer. B. Aspiration pneumonia. Rationale. Dysphagia increases the risk of aspiration pneumonia, which is the most serious complication. Dehydration and electrolyte imbalances are possible due to difficulty swallowing, but aspiration pneumonia is a more immediate concern. Sleep disturbances are unrelated to dysphagia. Question 23. A patient with a recent brain injury is experiencing confusion and disorientation. What is the priority action by the nurse? A. Administer a sedative. B. Assess the patient's level of consciousness using the Glasgow Coma Scale. C. Notify the healthcare provider. D. Provide verbal reassurance to the patient. Answer. B. Assess the patient's level of consciousness using the Glasgow Coma Scale. Rationale. The Glasgow Coma Scale, GCS, is the best tool for quickly assessing the severity of a patient's neurological status, especially after a brain injury. Administering sedatives, notifying the provider, or reassurance may be necessary. But first, the nurse must assess the patient's consciousness. Question 24. A patient with Parkinson's disease is experiencing rigidity and bradykinesia. Which medication would the nurse expect to be prescribed to address these symptoms? A. Levodopa. B. Diazepam. C. Prednisone. D. Lorazepam. Answer. A. Levodopa. Rationale: levodopa is a dopamine precursor used to treat the symptoms of Parkinson's disease, including rigidity and bradykinesia. Diazepam, a benzodiazepine, prednisone, a corticosteroid, and lorazepam, another benzodiazepine, do not address the specific pathophysiology of Parkinson's disease. Question 25. A patient diagnosed with meningitis is prescribed intravenous antibiotics. The nurse should monitor for which of the following adverse effects? A. Nephrotoxicity. B. Tachycardia. C. Hypokalemia. D. Dehydration. Answer: A. Nephrotoxicity. Rationale: many antibiotics used to treat meningitis, such as aminoglycosides, can cause nephrotoxicity. The nurse should closely monitor kidney function. Tachycardia, hypokalemia, and dehydration are less commonly associated with intravenous antibiotics for meningitis. Question 26. A patient with a spinal cord injury at the C4 level is experiencing difficulty breathing. What is the nurse's priority intervention? A. Administer oxygen via nasal cannula. B. Initiate mechanical ventilation if the patient's breathing becomes inadequate. C. Assess the patient's blood pressure. D. Elevate the head of the bed to improve breathing. Answer: B. Initiate mechanical ventilation if the patient's breathing becomes inadequate. Rationale: a C4 spinal cord injury can impair diaphragm function, and the patient may be unable to breathe adequately. Mechanical ventilation is necessary to maintain oxygenation. Administering oxygen via nasal cannula may be insufficient if the patient is unable to breathe on their own. Blood pressure assessment and positioning are also important, but secondary to managing the airway. Question 27. A patient with a history of seizures is prescribed phenytoin. Which of the following is the nurse's priority teaching point regarding this medication? A. You must avoid taking this medication with high-protein foods. B. Be sure to have regular blood tests to monitor drug levels. C. You should take this medication on an empty stomach. D. You can stop the medication if you feel better. Answer: B. Be sure to have regular blood tests to monitor drug levels. Rationale: phenytoin has a narrow therapeutic window, so regular blood tests to monitor drug levels are essential to avoid toxicity. Avoiding high-protein foods is not necessary, and taking the medication with food is often recommended to reduce gastrointestinal upset. Discontinuing the medication without medical guidance can lead to seizures. Question 28. A patient presents with a sudden onset of right-sided weakness and aphasia. The nurse should prioritize which intervention? A. Perform a neurological assessment. B. Administer thrombolytics, if within the appropriate time frame. C. Assess the patient's blood pressure and oxygen levels. D. Place the patient in a lateral decubitus position. Answer: B. Administer thrombolytics, if within the appropriate time frame. Rationale: sudden weakness and aphasia are signs of a stroke. If the patient is within the therapeutic window, usually 3 to 4.5 hours for thrombolytic therapy, administering thrombolytics can significantly improve outcomes. A neurological assessment, monitoring vital signs, and positioning are important, but thrombolytics should be administered as soon as possible if indicated. Question 29. A patient with Guillain-Barré syndrome (GBS) is developing respiratory distress. What is the nurse's priority action? A. Administer corticosteroids as ordered. B. Assess the patient's respiratory status and prepare for possible intubation. C. Start an IV line for fluid resuscitation. D. Reassure the patient and family. Answer: B. Assess the patient's respiratory status and prepare for possible intubation. Rationale: respiratory failure is a common complication of Guillain-Barré syndrome due to paralysis of the diaphragm and respiratory muscles. The nurse should assess respiratory status frequently and prepare for potential intubation. Corticosteroids and IV fluids are part of the management, but are secondary to respiratory support. Reassurance is important, but airway management takes priority. Question 30. A patient with a stroke is at risk for developing a pressure ulcer. What is the nurse's most appropriate intervention? A. Reposition the patient every 2 hours. B. Administer prophylactic antibiotics. C. Apply an antiembolic stocking to prevent DVT. D. Encourage the patient to sit upright for long periods. Answer. A. Reposition the patient every 2 hours. Rationale. Repositioning the patient regularly helps prevent pressure ulcers, especially in immobile stroke patients. Prophylactic antibiotics are not indicated unless there is an infection. Antiembolic stockings help prevent DVT, but they do not address pressure ulcer prevention. Encouraging the patient to sit upright is not helpful and may increase the risk of pressure injury. Question 31. A patient with Alzheimer's disease is exhibiting aggressive behavior. What is the nurse's priority intervention? A. Administer sedatives as prescribed. B. Provide a calm and quiet environment. C. Restrain the patient to prevent injury. D. Provide a structured routine for the patient. Answer. B. Provide a calm and quiet environment. Rationale. Aggressive behavior in Alzheimer's disease often stems from environmental stimuli. Providing a calm and quiet environment is the most effective intervention. Administering sedatives should be avoided unless absolutely necessary. Restraint use is not appropriate unless the patient is in immediate danger. A structured routine is important, but secondary to addressing the current behavioral issue. Question 32. A patient with a history of multiple sclerosis, MS, is experiencing an exacerbation. What is the nurse's primary intervention? A. Administer immunosuppressive medications. B. Provide emotional support and reassurance. C. Encourage physical therapy to maintain function. D. Administer corticosteroids to reduce inflammation. Answer. D. Administer corticosteroids to reduce inflammation. Rationale. Corticosteroids are commonly used to reduce inflammation and shorten the duration of MS exacerbations. Immunosuppressive medications are not typically used for acute exacerbations. Emotional support and physical therapy are important, but corticosteroids are the primary intervention. Question 33. A patient with a brain tumor is experiencing increased ICP. Which of the following interventions should the nurse avoid? A. Administering medications to reduce cerebral edema. B. Hyperventilating the patient to lower CO2 levels. C. Elevating the head of the bed at 30 degrees. D. Monitoring vital signs frequently. Answer. B. Hyperventilating the patient to lower CO2 levels. Rationale. Hyperventilation can cause cerebral vasoconstriction, worsening cerebral ischemia in patients with increased ICP. The nurse should administer medications to reduce cerebral edema, elevate the head of the bed to 30 degrees, and monitor vital signs regularly to manage ICP effectively. Question 34. A patient is being treated for a subdural hematoma. What is the most important assessment to monitor? A. Respiratory rate and effort. B. Glucose levels. C. Neurological status, including GCS. D. Skin integrity. Answer. C. Neurological status, including GCS. Rationale. In patients with a subdural hematoma, neurological status, including the Glasgow Coma Scale, is the most important assessment to monitor changes in consciousness and alertness. Respiratory rate, glucose levels, and skin integrity are important. Question 35. A patient with a stroke is unable to communicate verbally. Which intervention should the nurse implement to facilitate communication? A. Use simple yes or no questions. B. Encourage the patient to write responses. C. Use nonverbal gestures to communicate. D. Call the speech therapist for an immediate assessment. Answer. A. Use simple yes or no questions. Rationale. For patients with aphasia, simple yes or no questions can facilitate communication. Encouraging writing or nonverbal gestures can also be helpful, but yes or no questions are the most effective initial strategy. Calling a speech therapist is important, but should be done after attempting simple communication strategies. Question 36. A patient who recently had a stroke is showing signs of neglect. What is the nurse's priority intervention? A. Provide the patient with frequent verbal reminders. B. Encourage the patient to use the affected side during daily activities. C. Ensure the environment is safe and free from obstacles on the affected side. D. Encourage the patient to exercise the affected arm and leg. Answer. C. Ensure the environment is safe and free from obstacles on the affected side. Rationale. Neglect often results in the patient being unaware of one side of their body, leading to safety risks. Ensuring the environment is free of obstacles is the most immediate intervention. Verbal reminders and encouraging use of the affected side are important, but safety is the first priority. Question 37. A patient with a spinal cord injury at the T10 level is developing autonomic dysreflexia. What is the nurse's first action? A. Administer antihypertensive medication. B. Assess for a full bladder or bowel impaction. C. Raise the head of the bed. D. Place the patient in a supine position. Answer. B. Assess for a full bladder or bowel impaction. Rationale. Autonomic dysreflexia is most commonly triggered by bladder distension or bowel impaction. The nurse should assess and relieve the underlying cause first. Administering antihypertensive medications, raising the head of the bed, or placing the patient supine are secondary interventions. Question 38. A patient with chronic migraines is prescribed triptan therapy. What is the nurse's priority teaching point? A. Take this medication every day, even when you don't have a migraine. B. This medication can cause drowsiness, so avoid driving after taking it. C. Take this medication at the onset of a migraine, not as a preventive measure. D. You should not take this medication if you have high blood pressure. Answer. D. You should not take this medication if you have high blood pressure. Rationale. Triptans can cause vasoconstriction, which may increase blood pressure, so they should be avoided in patients with uncontrolled hypertension. Taking triptans only during a migraine attack is correct, and drowsiness is a side effect, but the most important teaching point is about contraindications. Question 39. A patient with a history of seizures is admitted with a new onset of confusion. What is the nurse's priority action? A. Administer antiepileptic medications as ordered. B. Perform a full neurological assessment. C. Check the patient's glucose level. D. Notify the healthcare provider of the change in condition. Answer. C. Check the patient's glucose level. Rationale. New onset of confusion in a patient with a history of seizures may be due to hypoglycemia, which should be ruled out first. Administering antiepileptic drugs, performing a neurological assessment, and notifying the provider are also important, but checking glucose is the immediate priority. Question 40. A patient with a suspected stroke is brought to the emergency department. What is the nurse's priority action upon arrival? A. Administer oxygen. B. Obtain a CT scan to determine the type of stroke. C. Start an IV for fluid resuscitation. D. Administer aspirin as ordered. Answer. B. Obtain a CT scan to determine the type of stroke. Rationale. The priority action is to obtain a CT scan to determine whether the stroke is ischemic or hemorrhagic. This will guide treatment decisions. Administering oxygen and starting an IV may be necessary, but are secondary to obtaining imaging. Aspirin is typically used for ischemic stroke, but should only be given once the